Bula, my name is Kalarandibue, ID A00234502, Lambasa Campus. My topic for this oral presentation is based on personality disorder, ADHD, and anxiety disorder. Secondly, emphasize on strength, encouraging personal strength, coping strategies, and resilience can enhance well-being overall. It's fantastic that you can pinpoint particular circumstances that make you think similar difficulties are faced by many people. Your, re- your readiness to ask for assistance demonstrate your sincere desire to get past these challenges. Integrative practices, techniques like mindfulness, therapy, exercise, and social support are crucial for managing symptoms and improving quality of life. Setting, setting aside 10 minutes each day to concentrate on the breath and gently refocusing when thoughts stray. Moving on to strategies for enhancing well being, mindfulness and relaxation. Yoga and meditation are two exercises that can help with anxiety reduction and emotional control. Have you ever tried exercise involving deep breathing? When you're feeling overwhelmed, they can be a very effective way to help you focus again. Support network, strong ties to friends, families, and support groups enable people to feel accepted and understood. You can improve your resilience by joining a support group, which can give you a sense of belonging and common understanding. Professional assistance, other, other modalities including cognitive behavior therapy, which is also known as CBT, can provide essential resources for managing obsessive compulsive disorder, enhancing well being medication, understanding mental health, particularly conditions like OCD, ADHD, and depression, which requires a comprehensive viewpoint that incorporate both clinical and non-clinical components. People can live better lives and overcome challenges more adeptly if they live an emphasis on holistic well-being. Moving on to mental health and well-being beyond diagnostic criteria, Pacifica cultural. Key concept holistic well-being, integration of mind, body, and spirit. Pacific, Pacific cultures overview health as a holistic concept where physical, mental, and spiritual health are interconnected. Well-being encompasses all aspects of life, including social relationship and connection to ancestors. Cultural identity and community, which include role of community, cultural heritage, spirituality, which include connection to spiritual, resilience and strength, which include cultural resilience, connection to land and environment, cultural connection to nature. The relationship with the land, ocean, and environment is crucial. Nature is often seen as a source of healing and strength, influencing mental health well-being. Narratives and storytelling. Uses of storytelling serves as a therapeutic tool, allowing individuals to share experiences, express emotions, and connect with others. It can help in processing trauma and fostering understanding. Cultural practices and healing methods. Traditional healing. Engaging with traditional healing practices, including the use of herbal remedies and rituals, can complement modern psychological approaches and cater to cultural preferences. Social determinants health, addressing cultural factors, which means recognizing that factors such as socioeconomic status, education, and access to resources, advocacy, and empowerment can enhance well-being. Intergenerational trauma, which include awareness of historical context, which means understanding the impact of colonization, migration, and historical trauma on mental health is crucial. This awareness can help address ongoing challenges within the community. Moving on to the importance of evidence-based practice. First one is effectiveness, which is EBP, are grounded in rigorous research and empirical evidence demonstrating the effectiveness in treating specific mental health issues. By relying on methods proven to work, therapists can provide interventions that have a higher likelihood of success. Informed decision making can help therapists make informed decisions about the treatment options by integrating clinical expertise with the best available research. Therapists can tailor interventions to meet the unique needs of each client, enhancing the overall quality of care. Consistency and accountability. It promote EBPS promote consistency in treatment approaches among practitioners. Increase client trust. When clients understand that their therapist is using practices supported by research, it can enhance their trust in the therapeutic processes. Adaptability and flexibility are not one size fits all. They can be adapted to suit individual client needs and cultural context. Continuous improvement. The field of counseling and therapy is constantly evolving. By engaging with EBPS, therapists stay updated in the latest research findings and emerging practices, fostering a culture of continuous professional development and improvement. Lastly, resource allocation. In a healthcare system with limited resources, EBP help prioritize intervention that are likely to yield the best result. This efficiency ensures that clients receive effective treatment in a timely manner, which is particularly important in public health settings. Moving on to mental health, well-being, and beyond symptoms. What is mental health and well being? According to the American Psychological Association 2013, mental health is a state of mind characterized by emotional well being, good behavioral adjustment, relative freedom from anxiety and disabling symptoms, and capacity to establish constructive relationships and cope with ordinary demands and stresses of life. Pacifica context in Fiji, the cultural beliefs of Indians found resonance with the Itoke. After 100 years of cultural interaction, many folks' beliefs are held in common. Metaphysical word is malevolent. Witchcraft is the first line of treatment. Societal identity has significant impact on Fijians' perceptions of mental health. Globalization has caused cultural erosion. Beyond symptoms and diagnosis, it seems to me that so much about psychiatry is geared to problems and difficulties, and the positive aspects of one's existence can perhaps not always be highlighted as much they might be by those who have diagnosed us. Thoughts of a peer support worker in London, personal perspective. Well-being is not just absence of an illness, how you feel about yourself, your life, and your life. It is a basic human right. Practitioner's perspective. Consider other beliefs, experiences, and other viewpoints. Also, growth promotion prevention should begin by identifying individual, social, and cultural determinants of mental health. Moving on to mental health and action plans. This is a case study of personality disorder named Makareta Mbisa. She is 17 years old. She's in 11th grade. Family situations. Makareta lives with both parents and has one younger siblings. Her parents are supportive but often are unaware of her struggles. Makareta's Mbisa's presenting issues. Makareta was referred to the school counselor after teachers noticed that she frequently avoided participating in class discussion and social activities. She often sat alone during lunch and seemed anxious in group settings. Symptoms: extreme shyness. Macareta Bisa feels intense anxiety in social situations, fearing judgment and criticism from peers. Avoidance of activities. She avoids participating in extracurricular activities, even those she enjoys, because she is afraid of being embarrassed or rejected. Low self esteem. Lisa has a negative self image and believes she is not as capable or likable as her classmate. Physical symptoms: she experiences symptoms such as sweating, trembling, and a racing heart when she anticipates social interaction. Therapeutic process: CBT, the social counselor implemented CBT techniques to help Margaret identify and challenge negative thought about herself in social situations. Gradual exposure. Margaret was encouraged to gradually expose herself to social situations, starting with small groups and eventually participating in larger class activities. Social skills and training. The counselor provided training on how to initiate conversations, making friends, and manage anxiety in social situations. Progress over the course of the school year, Margareta showed notable improvement. She began participating in class discussion, starting with small contributions and gradually becoming more vocal. Margareta joined a school club that aligned with her interests, where she made a few close friends. She reported feeling less anxious in school situations and expressed a more positive view of herself. Goals for treatment: symptoms and reduction, alleviate distress, help the individual manage and reduce symptoms such as anxiety, depression, impulsivity, and emotional instability. Decrease maladaptive behaviors, identify and modify behaviors that negatively impact the individual's life and relationship. Improving coping skills, enhance coping mechanism, um, this is to handle stress and emotional distress, develop problem solving skills. This is to address challenging in healthier ways, enhancing self awareness, which include increased insight. This and help it helps individuals to understand their thought, feelings, and behaviors, and help foster greater self-awareness and recognitions of patterns. Identify triggers. It encourages individual to identify the situation or event that exhibit the symptoms. Building interpersonal, which includes improved relationship and enhanced empathy. Improved relationship includes developing healthy communication and relationship skills to foster better interaction with others. Enhance empathy. It helps to understand and relate to others' feelings and perspective, which can improve social functioning. Boosting self-esteem, which include foster a positive self-image, which is to work on building a healthier self-concept and reducing self-criticism. Encourage self compassion. It is to teach individuals to treat themselves with kindness and understanding. Setting and achieving personal goals, which includes encourage goal setting, setting realistic and achievable personal and professional goals, promote a sense of purpose, help individuals find meaning and purpose in their lives, enhancing motivation and engagement. Facilitating long-term change, which include encourageable sustainable change and prevent relapse. Encourage sustainable change simply mean it is to aim for lasting improvement in functioning and well-being, promoting continued personal growth and beyond therapy. Prevent relapse, which means equipped individual with strategies to maintain progress and cope with potential setbacks in the future. Role of this DSM: Diagnostic and Statistical Manual of mental disorders. First one we can see it is standardized classification, which include uniform diagnostic criteria and clear definition. Uniform diagnostic criteria, it means ensuring consistency in the classification and understanding of these conditions. Clear definition, it is defined by the specific criteria. It helps clinicals accurately identify and characterize mental health issues. Clinical diagnosis, which includes guiding assessment. It helps determine the presence of a disorder based on reported symptoms, facilitating treatment planning, which means it develops appropriate treatment plans tailored to the individual needs, including therapeutic interventions and medication management. Research and Education Foundation for Research. The DSM serves as a foundation text for research in psychology and psychiatry, facilitating studies on the prevalence, etiology, and treatment of mental health disorders. Education resource. It is also used in training programs for mental health professionals, providing essential knowledge about various disorders, their symptoms, and diagnostic criteria. Communication tool, which include facilitating communication with the DSM provide a common language for clinical researchers and educators to discuss mental health issues, which improve collaboration and understanding among professionals. Insurance and policy use determine coverage. It determines coverage and reimbursement for mental health service. Evolutions of mental health understanding include reflecting evidence advances in knowledge and inclusions of new disorders. Moving on to psychological disorder, this is a pattern of behavior or psychological symptoms that impact multiple areas of life. These disorders are often associated with significant distress and impairment in functioning, affecting how individuals think, feel, and interact with others. Some key aspects of psychological disorder. Firstly, the symptoms. Psychological disorder are characterized by a range of symptoms, which can include difficulty, persistent sadness or anxiety, difficulty in concentrating, changes in eating or sleeping habits, withdrawal from school activities, and hallucination or delusions. As you can see, the diagnosis and types of psychological disorders. The first one is diagnosis statistical manual of mental disorder, which is also known as DSM-5, anxiety types, and there are several categories of psychological disorder, which include anxiety disorders, mood disorders, personality disorders, psychotic disorders, and OCD, which is obsessive compulsive disorders. Local and international. Ministry of Education, which include mental health awareness, support services, and training for teachers. Ministry of Health, National Mental Health Policy, access to services, community-based programs. World Health Organization includes mental health action plans, focus on specific disorders, promotion of well-being. Reflections on the disorders. Well-being encompasses cognitive and emotional and social aspects, influencing how we think, feel, and act. It affects our stress management, relationship, and decision making. Key components of well-being can include emotional well-being, which means the capacity to understand and manage emotions, fostering positive feelings like happiness and satisfaction. Psychological well being, which involves self acceptance, personal growth, and the pursuit of meaningful goals. Lastly, social well being, which reflects the quality of relationship and social network, highlighting the importance of social connection. Overall, well being is a multidimensional concept that plays a crucial role in mental health and quality of life. Lastly, as you can see in my oral presentation, is the reference. This is where that I did my research and it supported my oral presentation. Winaka. As you can see, this is my presentation outline. The body of this oral presentation, the personality disorder, the mental health and well-being, attention deficit hyperactivity disorder, anxiety disorder, and the definitions, key features, mental health and action plans and policies for this oral presentation, role of DSM, uh, Pas- Pacifica cultural implication in mental health and well-being, psychological disorder, and our own personal reflections. Moving on to the presentation objective. Upon successful completion of this topic, I will be able, after this oral presentation, I'll be able to demonstrate the sound understanding of the various psychological or on ADHD, personality and anxiety disorder. The important, we have to recognize the important within the Pacifica context and go beyond symptoms and diagnosis. We have to be aware of the mental health and action plans and policies guided by local MEHA and MOHFJ and international standard World Health Organization. Reflect upon personal understanding of psychological disorders and its application to the Pacifica context. Moving on to the definitions of personality disorders. Personality disorders are a group of mental health conditions characterized by enduring patterns of behavior, cognition, and inexperience that deviate from cultural expectation, are inflexible, and lead to significant distress or impairment in functioning. Key features key features of personality disorder are persistent patterns with as you can see, I have the definition with a expl- with an explanations: impairment, distress, and inflexibility. Persistent patterns means enduring traits and behaviors that are stable over time. Impairment, significant difficulty in social, occupational, or other areas of functioning. Distress, these patterns often cause distress to the individual or those around them. Inflexibility, difficulties adapting to new situation or context. Moving on to attention deficit hyperactivity disorder, which is also known as ADHD, is a neurodevelopment disorder characterized by persistent patterns of inattention, hyperactivity, and impulsivity that interfere with functioning or development. As you can see, on the other side of this box, we have the key features of attention deficit hyperactivity disorder, in which the first one says inattention, which means difficulty sustaining attention, organizing tasks, and following through on instruction. Hyperactivity, excessive fidgeting, talking, and difficulty remaining seated or quiet. Impulsive, impulsivity, hasty action that occur without forethought, leading to potential harm or negative consequences. The third one is anxiety disorder. Definition of anxiety disorders: a group of mental health conditions characterized by excessive fear or anxiety that interferes with daily functioning. They include disorders like generalized anxiety disorder, which is also known as GAD, panic disorder, and social anxiety disorder. Key features of anxiety disorder: excessive worry. Those people who those people who worry or think about something they really want to achieve, which can also lead to stress or also can lead to personality disorder. Excessive worry, persistent excessive anxiety about various aspects of life. Physical symptoms can include restlessness, fatigue, fatigue, difficulty concentrating, and physical reaction like increased heart rate. Avoidance behaviors, avoiding situation or stimuli that trigger anxiety. Impact of functioning: symptoms significantly impair social, occupational, or other important areas of function. Moving on to the historical origin, etiology, and psychopathology of the three disorders. Personality disorder, early understanding. The concept of personality disorder dates back to early psychiatric classification where traits were considered pathological. DSM evaluation, as you can see, the DSM has evolved significantly with the first edition in 1952, recognizing personality disorder as a distinct from other mental health conditions. Also, the second one is current classification with as you can see on the presentation board with the mini classification, current classification. Moving on to attention deficit hyperactivity disorder, historical origin, early observations. Symptoms resembling ADHD were documented in the early 20th century, initially termed minimal brain dysfunction. Modern classification, the term attention deficit hyperactivity disorder was introduced in 1980 and has since been advocacy have led to improved diagnosis and treatment approaches over recent decades. Moving on to anxiety disorder, historical context. Anxiety has been recognized since ancient times, often linked to philosophical and medical explanation. It was also evolved in the 20th century with the DSM incorporating various types of anxiety disorders. Research growth, increased research has focused on understanding the neurobiology and treatment of anxiety disorder in recent decades. Etiology of personality disorder, as you can see, it has biological factors, environmental influences, and psychological factors. Which means biological factors means genetics and neurobiology plays roles. There may be hereditary components, environmental influences, childhood experiences, trauma, and cultural factors significantly impact development. Moving on to psychological factors, patterns or thoughts, coping mechanism, and personality traits contribute to disorder development. Etiology of attention deficit hyperactivity disorder, genetic influences strong, familial patterns suggest or genetic components, neurobiological factors, brain structure and function differences, particularly in areas related to attention and impulse control, have been noted. Environmental contributors, parental exposure to substances like tobacco and alcohol, low birth weight, and psychological factors can influence risk. For anxiety disorder, genetic factors, family history can increase susceptibility. Environmental stresses, life events, trauma, and stress can trigger or exacerbate anxiety. Biological vulnerability, dysregulations of neurotransmitters, example serotonin, dopamine, and may contribute to symptoms. Moving on to psychopathology for personality disorder. The first one is cognitive distortions with the meaning. Second one is emotional dysregulations and intrapersonal problems. For attention deficit hyperactivity disorder, executive function deficit, emotional dysregulations, compulsibility, and for anxiety disorder, we have cognitive theories, behavioral responses, and neurobiological mechanism. Moving on, why psychotherapy? Mental health improvement. We have symptoms relief. Psychotherapy can significantly reduce symptoms of various mental health disorders, including depression, anxiety, and PTSD, which means psychotherapy can reduce the symptoms if people are going through mental health disorders, which include depression and anxiety. Psychotherapy is the is the best is the best relief or symptoms which can cure mental health disorder and also depression and anxiety. Coping strategies. Therapy helps individuals develop coping mechanism to manage stress, anxiety, and emotional challenges. Insight and self-awareness. Understanding behaviors. It allows individuals to explore their thoughts, feelings, and behavior, leading to greater self-awareness. Insight and self-awareness, understanding behavior means it gives people freedom. It allows individual to explore their own thoughts and feelings and their behaviors in order to have greater self-awareness. Identifying patterns, therapists help clients to recognize maladaptive patterns in their lives and enabling them to make positive changes. Behavior change, breaking habits. Psychotherapy can help individuals identify and change harmful behavior and habits. Example, substance abuse and unhealthy eating. Building resilience, therapy can enhance resilience, equipping individuals to face challenges more effectively. Moving on to support and validations, safe space. Psychotherapy provides a confidential and safe environment where individuals can express their thoughts and feelings without judgment, which means psychotherapy it it provides individual with safe environment, which means um, where where they can express their own thoughts and feelings without people without people judging them. Emotional support, a therapist can offer support and validation, helping clients feel understood and less isolated. Personal growth, goal setting. Therapy encourages setting personal goals and working towards achieving them, fostering personal development. Enhancing relationship. Clients can learn effective communication and relationship skills, improving their interaction with others. Addressing underlying issues. Root causes. Psychotherapy helps individuals explore and address the root causes of their issues rather than just treating symptoms. Trauma processing. It can facilitate processing traumatic experiences, reducing their long-term impact on mental health. Improve quality of life satisfaction. Engaging in therapy often leads to increased overall satisfaction and quality of life as an individual learn to manage the emotions and improve the situation. Empowerment therapy empowers individuals to take charge of their mental health and make informed decisions about their lives. Mental health and action plan, anxiety disorder, cognitive behavior therapy. Cognitive behavioral therapy, CBT, which is also known as a CBT. This is one of the most effective treatment. This is one of the most effective treatment for anxiety. It helps individual identify and challenge negative thought patterns and behaviors related to anxiety. Exposure therapy. This form of CBT gradually exposes individual to the sources of anxiety in controlled way to reduce fear and avoidance behavior. Acceptance and commitment therapy, ACT, which is also known as ACT, encourage individuals to accept the thought and feeling rather than fighting them or promoting mindfulness and commitment to personal values. Mindfulness-based stress reduction. This approach combines mindfulness meditation and yoga to help individuals reduce stress and anxiety. Interpersonal therapy. It focuses on improving interpersonal relationship and social functioning, which can help alleviate anxiety. ADHD, attention deficit hyperactivity disorder, cognitive behavior therapy, cognitive cognitive behavioral therapy can help individuals with ADHD develop organization skills, time management, and coping strategies to manage symptoms. Behavioral therapy. This focuses on modifying specific behavior through reinforcement and consequences, which can be particularly effective for children with ADHD. Parent training programs. These programs teach parents strategies to help manage their child behavior and support their development. Psychoeducation. Psychoeducation, educating individuals and families about ADHD helps them understand the disorder and help develop effective coping strategies. Mindfulness and meditation. Mindfulness techniques can help individuals with ADHD improve focus, reduce impulsivity, and manage stress. Personality disorder. As you can see, we have one, two, three, four, five personality disorder with their meaning. Mental health and well-being symptoms and diagnostic criteria. First one is well-being above diagnostic standard. Beyond label, focusing on parents' experience rather than just diagnosis can lead to a thoughtful, efficient approach to care.